Can you see that? Excellent. All right. So we're going to talk today about initially just about what are advanced directives, and I'm going to really focus on psychiatric advanced directives, which I know in Ohio came up when I was working in the state hospital like 21 years ago with a big push, and then at least the push faded. I don't think they've gone away, but it sounded like a topic we should all at least know about. And there seems to be renewed interest, at least looking online, that more people are talking about these. So that's going to be our focus for today. So no disclosures for this. And so I wanted to mention kind of where did this really start? So there actually goes all the way back to 1991. And this was called the Patient Self-Determination Act. And the concept here was, now this is around CMS, so Medicare and Medicaid funding, but that is about half of all healthcare in this country. So that's the big gorilla basically as far as laws starting to change the ways things happen with other insurers as well. And so basically it said that everybody has to give patients a statement of rights regarding making healthcare decisions, and it really started this discussion, including advancing the concept of an advanced directive to the person, when they're competent, and we'll talk a little bit more about that, can then state what they'd like to have done when they are no longer competent. Usually that's a brief period of time, although that, of course, as we get older, could be permanent if it's a dementia or something like that. So that's the concept. And in fact, in my looking, the vast majority of Americans actually have any version of an advanced directive are older individuals that are facing health issues. More younger individuals, my read is, are afraid to do these, as though doing a living will means you're about to die or something. There's this, we struggle around this whole concept of life and death still. So what is an advanced directive? So this really is a legal issue. It's a document that tells basically, and some of these are very detailed. I'll show you the Ohio form very rapidly later on here, probably about 2 o'clock when we get to that point of the talk. Okay, just checking if anyone's paying attention. All right, so so express your wishes when you're not able to express your wishes. And the most common examples, and some of you may even have these, are a living will and a medical durable power of attorney or healthcare power of attorney. Different states use a different language. And the concept here is, hey, I'm thinking very clearly today, I'm in good health, but you know what? I want to live forever. Give me all the care you can possibly give me. Or you know what? If I can't do these 3 things that to me are quality of life, and I'm facing heroic measures, don't do them. Right? So I don't want that. That's not how I want to live, or sort of live, as it were. Right? So you can lay that out in advance, as opposed to leaving it to the doctors and nurses to try to talk to your next of kin and have them make decisions, which they're already stressed. Right? So, and then of course they're also going to impose their thought process on the world and on you, as opposed to you having, they can claim, hey, oh, I know what he would have wanted, but you know, if you've written it down, everybody knows what you wanted. Right? So it's really it's a self-protection as well for each individual. And so the states vary. I'll show you a map that shows where people are doing these for psychiatry, but they do vary. It's always about completing a form. It's a legal document, getting it signed, generally at least with a witness and or a notary public, and I'll show you that as well, because it is a legal document. You can see down here, notice that this one came from cancer.gov. Again, people facing illness, although nowadays cancer may be something you have for decades, because we're getting better at treating it, not perfect by far, but so that you may want one of these in place in the event that things go the wrong direction, even after you've been diagnosed, but mentally you're competent to make that decision. So here's an example. Again, advanced directives, not particularly psychiatric advanced directives, but this is called the 5 wishes. And this actually combines a living will and the healthcare power of attorney. And then it touches on comfort and spirituality. So it really is, it's a bit more holistic in its approach. It is officially something you can do as a document. And here are the 5 things that you're supposed to talk about with your person. So you don't just do this in a vacuum. You generally are talking this out, maybe even with an attorney. And many attorneys are adept at these. If you find one who does these, they know how to ask you these questions, kind of walk through. So a lot of times it's in the beginning, well, who would you trust? And presumably you've talked to said person. Who would you trust to make decisions when you're not able to? Right? Very, very important to have that healthcare proxy, as it were, have that person be somebody you trust. And oftentimes that is a significant other or a relative who knows you well and you know them well. And you do. Some will even say, hey, brother and sister were around the same age. You're mine, I'm yours. Right? That because you know each other. That's the longest relationship we have in life, is our siblings, right? So that may be the person you would trust, or maybe that's the one you definitively don't trust, depending on your relationship. But so you're going to find somebody who you feel confident would enact your wishes in a moment when you cannot. And obviously that's good. That's better for the treatment team, physician, nurse, etc. And if it's psychiatry, it may be social work, LPCT, et cetera, you're looking, you want rapid care. Well, it's harder if they have to stop and try to find somebody who can make a decision, right? That's not really in your interest at that moment. So there's good reason to do these. So what kind of treatment do you want? And also what kind of treatment don't you want? So my example, the extreme example, of do you want some version of extreme, like do not resuscitate under certain circumstances, or do you want do everything, give me the SPECT scan or the PET scan, or do it all, try to keep me alive under all circumstances? And then most people are probably somewhere in the middle of that. Your comfort, right? Now that may get into giving you morphine or other things for comfort measures. Maybe you don't want that. Maybe you do want that. That's kind of those types of things. Obviously, religion gets in here. So blood transfusions, you may or may not be willing to accept those. Those kind of things are nicer for the treatment team if this is already laid out. And obviously, it's better for you as the person if you've laid these out. How you want to be treated, and then also how much do you want to share? So we've talked before about HIPAA and so forth. So how much do you want your loved ones to know? Lay that out now, right? Don't let it be a guess. Well, I'm sorry, we can't tell you anything because he never signed a form and now he can't. So we're gonna tell you nothing. That's not helpful to the family, the loved ones, their significant others, anybody who's trying to understand what can we do, how can we help. So here's a real quick video real quick, like 3 minutes, just give you an overview. This NRC organization seems to be the national organization for psychiatric advanced directives. So we're going to move into the PAD, as we'll call it from here on out, because it's only real if it's an acronym. So we're going to go forward on that, and then I'll show you a lot of more detail on the psychiatric advanced directive. I think I embedded this correctly, so let's see. If you can't hear the sound, let me know, but I think I did enable that.
According to the National Alliance on Mental Illness, consumers frequently experience situations in which they are given little control over important treatment decisions. Families just as frequently are frustrated by having to stand by and watch their loved ones deteriorate and suffer. Psychiatric Advanced Directives, or PADs, have recently emerged as potentially helpful tools in resolving these problems by outlining consumer preferences for future care. In this presentation, we will discuss how these laws can be helpful to consumers, families, and clinicians. Not all states have separate Psychiatric Advanced Directives laws, so it's important to understand the law in your state. To learn more about your state, you can go to the National Resource Center on Psychiatric Advanced Directives website and look up your state.
A PAD is a legal document that states the consumer's preferences about his or her mental health treatment, anticipating that the consumer may not be able to state those preferences in the future exactly when care is needed. The information in PADs helps the consumer, their families, and their treatment providers in pursuing the consumer's preferred care.
The information in PADs describes crisis symptoms, states medication and hospital choices, lists emergency contacts, documents relapse and protective factors, and relates instructions to staff and others. This information has several uses.
An important use of this information is to empower the consumer to direct treatment decisions during a crisis. PADS can also be very useful in enhancing communications about treatment preferences among the consumer, their caring family, and treatment providers. PADS may facilitate appropriate and timely treatment interventions before situations deteriorate to emergency situations. Finally, PADS may lead to reductions in adversarial court proceedings over involuntary psychiatric treatment. A familiar treatment provider can help a consumer create a psychiatric advance directive by explaining options and offering valuable insights and guidance.
Under state law, there are two kinds of psychiatric advance directives you can fill out. First, you can write what's called an advance instruction, where you say what kind of treatment you'd want to have if you had a mental health crisis. So you can write what kind of medications you'd want and what kind of medications you wouldn't want, what hospital you'd want to go to and what hospital you wouldn't want to go to. You can include mental health and physical health information you think it would be important for doctors to know. I want to tell you about the second kind of psychiatric advance directive you can write. This one is called a healthcare power of attorney, where you choose someone you trust to tell doctors the kind of treatment you'd want to have if you had a mental health crisis. So this person, called a healthcare agent, would tell the doctors what kind of medications you'd want and what kind of medications you wouldn't want, what hospital you'd want to go to and what hospital you wouldn't want to go to, and give doctors mental health and physical health information you think it would be important for doctors to know. Do you or someone you know need the benefit of a psychiatric advance directive? Visit the National Resource Center for Psychiatric Advance Directives website and obtain specific information for your state. While you're there, subscribe to our newsletter for continued updates on PADS.
Okay. So hopefully that's at least helpful, although dry. There aren't very many videos online about this, but at least I think sometimes it's good to hear it from another voice as opposed to just the one talking to you now. So real simply, and I pulled these, I'll show you the references at the end. I pulled these various slides from very many websites. There are myriad websites who discuss the Psychiatric Advance Directive. I'm going to give you the big ones like the NRC, NAMI, Mental Health America, and so forth at the end. But they all talk about it. Even the Department of Mental Health and Addiction Services website mentions them and then immediately kicks you to the Disability Rights Ohio website, which I've also referenced at the end here. So again, legal document, preferences for future mental health treatment and/or you're doing it in advance, but obviously it might be today's treatment if it's already been filled out and now you are decompensated, whatever is going on with your illness, you're not able to make decisions for yourself. It does two things: appointing a health proxy, again, that individual we talked about before, and then listing the types of things you do and don't want. And the psychiatric one is pretty detailed, and so you'll if you haven't seen one, you'll be interested in that in a few moments. Obviously, you do it when you're doing well, and you can't do it when you're not doing well, and in fact, you can't negate it when you're not doing well either, which is very important. So once it's set, unless you're doing well and you fix it before you aren't doing as well. So what do? Obviously, this is a conversation. This is not supposed to be done in a vacuum. You're supposed to look at the concept here, supported decision-making. So the attorney, perhaps better yet, a clinician who feels comfortable with these, has this conversation. Maybe it's a person in the outpatient setting who's been getting care, psychiatric care, and you say, hey, have you considered one of these? Let's talk about it. I've seen a little bit of literature on peer support specialists being adept at these and being part of that process. And in fact, that seems to increase the percentage of people who actually do complete the Psychiatric Advance Directive. So that's also interesting. Having said that, it's a very tiny fraction of people. Less than a third of Americans have any version of an advance directive, and within psychiatric community, the range is really small. The last study that was done was 2006, so that's not in our favor either. But it was like 5% was the maximum, so it's very, very small percentage. have done these, and my belief as a psychiatrist is that's because we just don't do a good job of addressing death. We really struggle around that. That's part of suicide issues and everything else. So you want to look at what are the barriers, what might come up, what are the things that you need to make sure you have an opinion about that gets detailed in the formal document, any accommodations around this, how do you want to make that happen, levels of comfort, etc. Obviously, there's legalese on here, but that's within the template, which is why you don't just type this up yourself. You want to have some of that. They do, by the way, have forms online nowadays. You can also fill out and get them witnessed and notarized, and that makes them official. So you do not have to necessarily go to an attorney, which is why I'm emphasizing don't do it in a vacuum, because in theory you could now do it in a vacuum, but you do need a witness. You should identify a healthcare proxy and so forth. And obviously it's very important. This is set up in a way that is legitimate. So not unlike a will, people later on, after somebody passes, can contest a will, and then they'll have to hire generally psychiatrists. I've done these myself, to basically do an evaluation on testamentary capacity to decide whether the person was competent at the time they made the will, which is not an easy task because the person is no longer alive. So then at that point, I've had to go back and try to figure out, based on what's in the will, does it match other things they did in their life, looking at tax returns, where did they donate their money to, lots of other things to try to figure this out. Because, of course, generally it's contested by family who aren't getting money from the will versus people that are getting money from the will. That's it's all about money. These are different. This is obviously about, well, do you want to be kept alive or not? And of course, that could get into money, right? One daughter says, he never wanted to live like this, but meanwhile, in the background, she's got a bunch of debt and she's hoping to wipe it out with her inheritance. And the other daughter is like, wait a minute, no, he talked to me a lot about this stuff, and this is a situation he would have wanted us to get him the right treatment, right? So that you want this in writing, because you don't know how this will play. So this, again, NRC is the big organization. They monitor all of the states. You can see here that 27 states, so a bunch don't have these laws in effect, although every state has some version of a living will or power of attorney for healthcare. So you can do a version of this, but to actually have a psychiatric advance directive, again, based on that 1991 Self-Determination Act, even this many years later, we're at 27 states that have these. You do see here that Ohio is one of those. And if you go to this website and you click on Ohio, it gets you into, I'll show you that at the end of the references as well, but you can see what does Ohio have, and you can even get an example of a form, which I will show you today. So prior to 2003 in Ohio, so I'm going to move now to Ohio, only the DPOA existed as far as making health decisions for another person. And although it does address mental and physical issues, which is sufficient for many people, it really doesn't go into mental health issues in any detailed way. And so if you're somebody who is dealing with a mental illness, especially if that brings you into urgent care or crisis care on a regular basis, then the DPOA really isn't sufficient. It really doesn't cover the nuances around medications or which medications and things of that nature, which you may have very strong opinions about when you're doing well. And so you'd like your wishes to be granted when you're not doing well. So that's the reason for having a PAD separate from or on top of, in fact, a durable power of attorney. So 2003, I was at North Coast at the time. And I remember there was a big push across the state through, it was actually ODMH at the time. They had not merged with Odatis. And so they really looked at this and said, let's do something detailed here, right? Again, so it's the naming of the proxy, who's that individual who you have entrusted with your mindset of what you would like done and not done, when it will be used. Generally, it's some version of you're unable to make decisions as determined by two physicians, something of that nature. But you can outline that here. There's some wiggle room there. What is your designee? What can they do? Right. It also protects that person from liability. It also protects, gives them HIPAA information, so it's automatically defined. I'll show you that on the form. So that's automatic. Obviously, that would be a barrier if somebody appoints me and now they're not competent, but then I also don't have a release. How does the team work with me, right? Everyone's very nervous about HIPAA because it was rolled out with the stick, jails and fines as opposed to the carrot of improving communication. So these have to include the HIPAA piece in there, and 42 CFR Part 2 if you've got a substance use issue as well. The other thing is, this is very important, that the PAD cannot be overridden by the designee of any other DPOA that you have. So if you've done an advanced directive because you really wanted a more detailed one about physical health, and then you happen to have a mental illness and you do the PAD wins as far as mental health decisions. So that's also very important in the legal, and that's again, Ohio's, not every state's the same, but in Ohio, that's how it's laid out, right? So very, very clear. And you'll see that if it's end of life care, the living will overrides it, right? So there really is this balance of the physical care and literal life and death versus your mental health care. And so Ohio, I think, is, from my read on this and from what I recall when this rolled out 20 or so years ago, pretty good balance. I think there's a lot of good work went into making that decision. So here's the process, and the next several slides are from Mental Health America, just so you know where they came from, and you'll see the reference at the end. So Mental Health America walks through this very carefully. I'm not going to do all this; it's too detailed, but you can read the slides that have already uploaded those to the iEcho platform. So obviously, think this through. Write it down. What are the things you want to consider? Who you want notified. I mean, some of this stuff never happens, right? The person's very ill, they end up in the hospital. The loved ones are actually looking for them, and they call the hospital, and the hospital says, I can neither confirm nor deny. It sounds like a Mission Impossible movie, right? I mean, you can't get through to get the information, and now your loved ones are left in the dark, and they're scared, and you're left without anybody to give you that human connection that we all know we need, and as COVID taught us in particular. So that's a problem. So you want to make sure, who do you want notified? Obviously, that would include how to notify them. So what happens to you during the crisis, and then what helps you recover? Because maybe you already know. I know that when I'm this ill, I do these behaviors because people have told me, or I remember some of them. And I know I'm better when X, Y, and Z is occurring. So that's great for your treatment team to know. Your baseline may include some low-level delusional beliefs, even though you're very functional. Maybe the treatment team needs to know that, so they're not trying to throw 5 more medications at you when in fact that's not going to make a difference, right? You're already at your baseline, and at that baseline, maybe you're able to work and you have your relationships and all that. So these can be very, very detailed if you choose to put that information in there. Again, who do you want involved in your care? Who can be consulted? You know what? My proxy is my sister, but my mother can give you great information. Please talk to her, right? Put that in there. Very good information and so forth. So a lot of that, how do you want to be treated? Well, I'm not going to go through this in detail. And any medical conditions or allergies, right? Hey, there's a good opportunity to lay out dangerous allergies that maybe your proxy will forget about, right? You better put that in there, right? Oh, I forgot they had a shellfish allergy and they can't get the IVP dye, right? I mean, now there are new versions of the dyes, I think, that actually avoid that, but still, that's an example. Finding your healthcare agent. So this is personal, right? You got to figure out who do you trust? Who do you want to share maybe even more deeper thoughts with them than you're going to put on paper, so that they understand some nuances that you don't necessarily want on paper, but you want them to understand what exactly you mean in this circumstance, because they will be relied upon by the physician or others on the treatment team when they're trying to figure out what to do about these types of situations. So very, very important. Writing it down, obviously, and here's in these, and you'll be able to click on these when you get the slide set. You can click on these, it will give you some information. So the National Disability Rights Network, for Ohio, when you click on this, you're going to go to Ohio. It's going to give you Disability Rights Ohio. So I've got that reference at the end. But again, if you're in another state, and I know we've had people on this Echo from other states, go on here and you can find what's in your state. So I didn't want to be only Ohio-centric for that reason. And others may watch this later on as well on the YouTube channel. So, and then the nrcpad.org, as far as I can tell, this has got it all. They do have a disclaimer on there. They try to stay up to date. Obviously, if a state changes the law or changes the form, it may not be perfect. You may have to verify that with an attorney. But by and large, the information is what matters. Having a witness, having a notary ultimately makes it legal. And of course, the form does no good if you do it and then stick it in your safety deposit box, right? Someone's got to know about this. So if you know you tend to go, I'll make it up, you tend to go to Cleveland Clinic Akron General when you're ill, they probably ought to have it on file in advance because it is an advance directive, right? So you want them to have it now so they can click and say, oh, yes, Doug Smith has one of these, right? Not, oh, now they're very ill. We got to figure out a relative who we can call, and we can't share much because we don't have a release, but we can at least ask them to give us information, including, hey, do they have an advance directive? So much easier if you now, if you don't know, that's a problem, but make sure then your proxy has a copy, right? So make sure maybe your proxy and a few other family members or support system people have them so that it's easily accessible if you need it, because otherwise you've done all that work for nothing. So that's I think people miss that step, and I remember one case at North Coast where we had that happen, where the person claimed they had one, in like 2005. So the people were doing these in 2004, 2005 in particular because of the push to try to get these done, and then nobody could find it. Right? It was like, well, and they were very psychotic, so they were able to tell us they had one, but we couldn't find anybody who had access to it. Right? So that was not a helpful situation for that person. So I'll go through this real fast because you'll have the slides. So here it is. This is the form. This is the one that will show up on the Disability Rights Ohio website. So presumably the most current form. And it is a declaration for mental health treatment, Ohio's phrase for psychiatric advance directive. So you can name who your physician is in general that is generally responsible, so they know they can find that person, he, she, they, to give better information. What medications do you consent to? Which ones do you not want? Now, there are conditions or limitations, right? If I have a side effect or something. And obviously, there is wiggle room here, right? So let's say you consent to the administration of only Xanax and Adderall, right? And then, but you need an antipsychotic. That's going to get into court issues, right? Now there probably will be a treatment over objection process, et cetera, because clearly the declaration is not feasible, right? And I do remember the same thing happened at North Coast. We had somebody who had documented the exact physician they wanted to treat them and the exact units. And as it happened, by the time they came to the hospital, that physician was on a different unit. So there's no way to accommodate both. And the reality is, trying to get somebody in North Coast, even back then, you didn't get to choose your units or your doctor, right? That's not how that works. So we had to start having different discussions with people as we encourage these being created. We need to be a little less specific because that's not going to work in all settings. You can't just say, I only want this doctor, this nurse, this social worker. That's not really what these are meant to do. ECT, you'll notice, is on here. So that gives at least some immediate thought process. Again, you hope that the person's had good discussion around this and not just watched One Flew Over the Cuckoo's Nest and therefore says no. So you really want to have, and I say that not in jest, because even medical students have seen that movie, which always amazes me, and even they are tainted by it unless they've been exposed to it on a rotation or something. The facilities, right, being admitted or not being admitted to certain facilities, there may be things you can put in there. Obviously, there's going to be limitations on these things because if you need it, you need it. So you're not always going to get your wishes on the PAD. Treatment preferences, right? Some people in Ohio have a wellness recovery action plan, a WRAP plan. Obviously, that would be nice to have it attached to this, right? Because that gives other details on the types of things that work in your world to help you recover and then ultimately stay well. Here's some people, right? Physicians and telephone numbers, other people, right? So that's very important, right? You can try to indicate where you want to be hospitalized and where, now notice it's prefer, because you can't obviously completely deny admission somewhere, but you can prefer not to go to. So, I've had a horrible I'm going to make this up. I've had a horrible experience at Windsor Laurelwood, but I'm willing to go soon. Right? Okay, fine, but it's a preference, right? If the bed's at Windsor Laurelwood and you need a bed, you're probably going to Windsor Laurelwood, and you'll get good care either way, even if you don't remember a good experience there. Okay, so and you can sort of see down here that there's a bunch of pages I didn't include, but just to give you some of that, who can visit, who you don't want to visit, you kind of thing, because maybe they agitate you when you're not doing well, and that's not helpful to your recovery, and you'd like to get out of the hospital quickly. So, right, that kind of stuff. How about who's going to take care of a relative or a pet that you normally take care of? You can designate that in here too. Again, you should have discussed that with said person, right? Oh, wonderful. I just got the call. I need to take care of this person's grandmother and their cat. Well, that doesn't, that's not going to go well necessarily. I'm about to go on vacation or whatever, right? So you can't really do this in a vacuum, as I said. Other information you want to put basically is what this is for. Then you've got your proxy, very important. And how do you reach them, right? And maybe another person. Maybe there's two people that you trust, and just in the event the person is on vacation, right? They happen to finally have saved up enough money and they're on a world cruise, and you're not going to reach them, and you need to be the treatment team needs to reach people quickly. The acceptance, right? So now the proxy, in this case, the way Ohio did this, which I think is the right way to do it, has to accept this. So they've got to fill out a form as well, and send this piece of form and say, yes, I accept that Nicole has declared me the proxy, whatever. Right? That's the way that has to play out. So again, instead of giving you all 12 pages, the forms also require a witness or a notary, the signature of the declarant, that would be the subject, the person writing this, or a notary. Generally both. The preference, of course, is both of each of these. There's a revocation section, right? Under what circumstances do you want this revoked? There is a renewal section, and the law says they're valid for 3 years unless it's validly revoked while competent. You cannot say, that's not what I meant, while you're now hospitalized and psychotic. I declare revoking it. No, you can't do that. You have to be competent to revoke your psychiatric advance directive, or in Ohio, their declaration. And again, of course, they have you sign officially a HIPAA release notice for your proxy, right? Because that's just to be sure, basically. I think the form would suffice, but it makes sense. They built this in, so there's no question around HIPAA that yes, your proxy is allowed to have all the information about your care, so they can obviously do the best in your stead for that. So there are a lot of reasons. You can see this is Doors to Wellbeing, another website that is very patient-centered, person-centered, and I liked this. So I'm not going to read all these, but it gives you a sense of why people. So if you're trying to talk to someone about doing a PAD, here's an example of what things they can do. Like, so I like number 5. For me, I want to have a PAD. So if I'm unable to articulate or advocate for my wishes, they're clearly written out, so that I can get the care I want rather than others making choices on what they believe is best for me. Because that is the standard, right? If they call your next of kin, if that's the only option, in theory, the next of kin are making the decisions in your best interest, and generally that they believe you would have made for yourself. That may not be true, again, depending on which relative they get a hold of. So there's about, you can see here is 9 good reasons that may help you as a clinician if you're trying to convince somebody that it's a good idea to do one of these. So I included this, and also the fact you can find, obviously, this website and get more information. This is the current version of the What If workbook. This is from the Disability Rights Ohio. You'll notice that the most recent revision was only in 2010. So not a lot of revisions, hardly any changes, honestly, from the 2006 that I could find as I looked. I saw this and this. I didn't see December 2008, but I saw 2006. And this is just the page from the 2010, but this is on the Disability Rights Ohio website. So another way to, if you're trying to encourage this with a loved one or a patient or yourself, here's a way to go and look and see what to do. SAMHSA is involved. They have a practical guide to psychiatric advance directives. And if anybody's really interested in these, I can even send you PDFs of some of these, because I, of course, pulled them off when I was doing the talk. But just to show you, so SAMHSA is very involved in this as well. And then I had to end with modern technology because, 2006 is a long time ago, 2010 in today's world. So there's an app for it. So SAMHSA has in fact created the My Mental Health Crisis Plan app in conjunction with the American Psychiatric Association. So you can in fact put a lot of information on here. Now, obviously you may have other things. You can't just use the app. You may need paper with signatures, witnesses, notary public, as I said, but at least it's there, right? You probably have your phone with you and you're picked up and you're psychotic, whatever you're doing, or you're very depressed or manic. You probably have your phone with you because, that just is attached to us physically now, it seems. So you probably have your phone, and if you can at least show them, they can even ask you. Obviously, we'd love institutions where hospitalization occurs to say, hey, do you have an app that has any information about your medical care wishes? Boom, there it is. So very, very useful. I appreciate that they created this, and want to make sure I shared that as far as the bringing us closer to the new millennium instead of 2006 there. So here's a bunch of resources. I did it in such a way you can click on them when you get them, but you'll see I covered just the big ones. So I've talked about the NRC, Psychiatric Advance Directive Group, Disability Rights Ohio, SAMHSA, American Psychiatric Association, Mental Health Association, Nord Center, just to give you something more locally, had some nice reference sheet. I think 1.5 pages, very brief on this. SMI Advisor. I think it's funny how it came up, but that gives you the links, like I left it as is. SMI Advisor, Serious Mental Illness Advisor does a lot of good stuff, and then NAMI. So you can probably find many others. These at least all have been vetted. So as opposed to you doing a random search, these have all gone through a process of scrutiny, and a lot of mental health professionals have looked at these and said, yes, they're real. So I will stop there and see if